So the big question is, with 4 presidents, 9 senators, 900 pages, 3 amendments, nobody knows what it does anymore. It now includes contraceptive care, it includes education, it includes the insurance itself, there's the non-taxes. That's why they've been able to stand up to several challenges. They claim everything you have to pay, it's not a tax, these are mandates. So, of course, we have some people here that can help you understand it. How does it affect you personally? Of course, the insurance side, medical care, most of you, other than increasing your rates, you're not going to see it directly. It's going to happen to everybody. The biggest problem for most of you is going to be as a business owner. Small businesses get hit as several different things. A lot of this has already gone into place. It started in 2010. There's still more coming up. It's going to keep going in all the way up through 2020 is when the last portions of this go into effect. We already have the new health care credits for small businesses, which is absolutely useless. For you to qualify for these health care credits, you have to have 25 or less full-time equivalent employees. They all have to make less than $25,000 a year. And you have to pay more than half of their insurance premium to get a credit. So it doesn't affect very many people. You do now have to issue all of your employees, if you give them insurance, a summary of their benefits every year. It'll be provided to you from their insurance company, but if you fail to provide it to your employees, there's a penalty for you as an employer. There is a new ratio going in. A lot of people were worried that the rates were going to jump very quickly. Part of this includes that the insurance companies cannot spend more than 20% on administrative costs. If their administrative costs go over 20%, they have to provide everything excess. It has to be refunded to the policyholders. So some companies started receiving refund checks last year when their insurance companies were above their mandated ratio. FSA, starting this year, your fixed spending accounts or flexible spending accounts, you can no longer contribute more than $2,500. This is a personal one for me. I have an autistic child. One of the things that a lot of the planning groups will help you do as a parent is they'll explain to you, you arrange it with your employer to set up a flexible spending account. They pull out $2,000 or whatever a month out of your paycheck. It's pre-tax, and that can be used to take care of your child's special education needs. Up until now, it's been unlimited. It basically means that you got a tax deduction for education costs for a minor who's not in a college, which is a big thing. Starting this year, you can't anymore. You can't go more than $2,500. And then payroll taxes started increasing this year. They rescinded the 2% Social Security, had dropped it down to 4.2% instead of 6.2%. And then also starting this year, there is a new Medicare tax. If you make over $200,000 as an individual, $250,000 as a married couple, there's an extra 9% on your Social Security, or on your Medicare. 0.9%. Takes it from 1.45% to 3.9 total when an employer-employee. Still to come. They have not activated the exchange programs. The exchange programs for individuals are almost ready to go into effect next year. They're going to also add them for small employers. That way you can purchase the insurance for your employees at a reduced rate on the exchanges. Starting next year, I believe, 2014, you can no longer have a waiting period of more than 90 days to provide health care benefits to your employees. And then there's reporting requirements going on. You have to report on employees' W-2s, their Medicare or medical benefits that you're providing them. The biggest portion that everybody is upset about is the mandates. There's an employer mandate and an individual mandate. The employer mandate actually isn't that big a deal. This is the one that says if you have employees and you don't provide them insurance, they may be able to penalize you. But there are so many requirements for it. The first issue is small companies. You have to be considered a large company, which means you have more than 50 full-time equivalent employees before you have to give people insurance. And then it's only the employees that make or that have more than 30 hours, the actual full-time employees, that cause the penalty. So based on 2010 figures, 97% of small businesses don't meet the requirement, so they don't have to do insurance. And of those same businesses, 96% of them that do meet the requirement already offer insurance. So, realistically, this employer mandate that everybody thinks is going to crush jobs and crush the economy affects 1% of the country's 6.5 small businesses. That's 71,000 employers out of 6.5 million employers that have to implement insurance by next year for their employees.
Does it sound like somebody made some statistics or got some statistics and then wrote a law that matched the statistics?
Just about. You have to have more than 50 full-time employees, which means you add up all your employees' wage or hours each month divided by 120. That tells you your full-time equivalency. 30 of them actually have to be full-time employees, and a employee has to request insurance through the exchange before you get a penalty. So there's very few people that are going to affect this. The bigger issue will be the individual mandate. This starts in 2014. All individuals have to have insurance. If you do not have insurance, you are charged 1% of your AGI or $95 per person in your family, whichever is more.
Are you trying to change the number of hours it makes it qualify for full-time, part-time?
No, it's written in there, it's 30 hours strict.
But I understand they're trying to change that to 8.
To 8?
This was presented at an economic conference. They're trying to drop that 8.
They may be trying to, but currently as the law stands, it's 30 hours marks full-time. Yeah. So, this is just for 2014. In 2015, it's 2%, or $325 per person in your household.
Per year or what?
Per year, per person.
Per person?
Which means basically in 2016, where it jumps up again, if you do not have insurance and you are married and you have 2 kids, the kids only get half price, you have to pay 3 times $700, almost $2,100 in penalties on your 2016 insurance or tax return for not having insurance. It is not tax deductible. This is a mandate. These are all, but we have somebody to take care of that. So, just for you. So that really is it. Thing is, don't panic. These are all things that you can plan ahead from. You just want to make sure that you have them in place. So I got a minute for questions.
The hardest thing I heard though is this: is that the systems. You got the British system, and then you got the Canadian system. British system, people can go out of their own network. Okay, they can say, I choose to pay my health care. Canada does not. That's why they come down to Canada and the United States and get certain procedures. In this system, he's mimicking an after Canadian, where you will not be able to go outside the system. That doesn't suck. So what is that? That's communistic?
How are they going to prove if you have insurance? Or how are they going to?
Well, that's why starting in next year, your employers have to print on your W-2 how much self-employed. You'll have a policy or a filing that comes from your insurance agent.
Scott, can you repeat that?
It was just asking how they're going to prove it. I think Ron's probably trying to say thing.
No,
Yes.
I've got a different.
You just like to have your name up there?
Uncovered
Where's your name?
California, and I've published this to the insurance companies, and they don't even know, and they're looking into it right now. Uncovered California says if the cost of the insurance is 8% or more of your income, then you're not subject to the penalty, and therefore you don't have to have the insurance.
Yes. There are 3 or 4 different other exclusions, primarily if you're American Indian, if you're below the poverty line, if the insurance is, or if your annual income right now for 2014 is less than $9,000. And then like you said, if your minimum level of insurance would be more than 8% of your gross AGI.
They don't, unfortunately, they don't say that. They don't say minimum level, and they publish the silver rates. So they're not saying which level on Covered California will constitute that 8% threshold.
Yeah, no, the threshold is the bronze level.
Oh, it is?
So it's not going with bronze.
What's going to happen to Medicare recipients?
Medicare recipients are covered. So as long as you have Medicare, that's part of insurance. Thank you very much.